Who should receive post-exposure prophylaxis? For patients who present within 72 hours of a possible HIV exposure, it is important to assess if the exposure presents a substantial risk of HIV acquisition. We consider any of the following to be a high-risk exposure: condomless receptive or insertive anal or vaginal intercourse, a percutaneous exposure to blood or body fluids contaminated with blood. Non-occupational post-exposure prophylaxis, NPEP, should be given within 72 hours of an exposure. Once the need for NPEP has been identified, the patient should receive an immediate dose. Choice of regimen. We administer a 3-drug regimen for NPEP. Several possible regimens can be used for NPEP. For most patients, we suggest tenofovir disoproxil fumarate, emtricitabine, TDF-FTC, plus an integrase strand transfer inhibitor, e.g. raltegravir or dolutegravir. Duration of post-exposure prophylaxis. Guidelines recommend a 28-day course of ART for persons with a significant HIV exposure. If the source is known and is willing to be tested, NPEP can be discontinued if a rapid HIV test, preferably a laboratory-based antigen antibody test, is negative, unless there is concern that the source is acutely infected with HIV. The source has HIV and a suppressed HIV RNA on ART, since such patients are at very low risk of transmitting HIV. However, certain patients may prefer to continue NPEP, despite the low risk of transmission.